Good afternoon, Tiegerman, parents, families, and friends, and of course to our beloved students if you're watching, greetings. My name is Dr. Jeremy Tiegerman. I'm the director at Tiegerman Schools. Welcome to my office. Today is the next video in a series of videos that I've produced to help all of you to stay informed, for all of us to be connected, and I think it's really going well. I'm always open to your suggestions, so if you have any suggestions for my videos, or you're looking for any, if you have any questions that you need answers to, please feel free to forward those questions, comments, or concerns to social@tiegerman.org. As I've said in previous weeks, if you have specific questions or concerns regarding your children or your child's program, please feel free to reach out to your teachers, to teaching assistants, to the therapists, or to building administration. Today's date is Friday, May 8th, 2020. I can't believe it. I say it every week. I can't believe how far we've come. We'll be completing week 7 of remote learning and about 5.5 weeks of teletherapy. I want to again thank all of our essential workers, frontline workers. You are doing everything that you can to keep us safe, and we are all appreciating all that you do for us. I also want to take this moment to thank all of our parents. It's become very, very clear that you guys are frontline workers too at home, and we've seen the wonderful work and effort you put in with your children. It hasn't been easy. Sometimes maybe you felt like you want to rip your hair out of your head, but you have done a remarkable job, and my building principals, my teachers, my therapists, all the teaching assistants who've been in touch with you on a daily basis have said that you've all done a fabulous job. So bravo, thank you for being part of our team and working together to educate your children. I want to bring to your attention a couple of reminders. Some of these things have been repeats from previous weeks. A reminder about the 2 surveys that we sent out over the last couple weeks. Our buildings forwarded you the first survey regarding your input on teletherapy and on your experience with remote learning. So your feedback is so very critical and important to us. Please, please, please make sure that if you have already done that, if you have not already done that, please forward that to your buildings. And if you have already done it, thank you so much. The second survey relates to your thoughts and feelings about having your children return back to physical space, to our buildings eventually. I know this is a very stressful, anxiety-provoking topic, and we are planning, as I've mentioned over the last several weeks, so we're just interested in getting your feedback. It's very important to us. We value it. So please, if you haven't done that, please forward that to us as soon as you can. Something that is going out at the end of this week, and if not, definitely early next week, we are sending out parents' signature forms on summer programming. And I can tell you right now that we are planning on having school over the course of the summer. As I've mentioned before, all of your children have 12-month mandated programming on their individualized education programs. The first day of summer session is Monday, July 6th, 2020. And we are seeking confirmation from all of you, whether it be remote learning, continuing on this, or if we are directed to return to our buildings. We are having our 30-day summer session. It's very important to make sure that we are meeting our students' needs and to prevent significant regression that would be happening if they weren't at school over the summertime. Again, it's Monday, July 6th, 2020. So please make sure that you take a look at that notification, that you sign it, fill it out, and send it back to us. Some wonderful new things that I wanted to mention to all of you. Our counseling staff and our behavior specialists have worked together also with our RBT, which are our registered behavior technicians, and they've started putting together social stories for our students. These are wonderful visuals, and they will have auditory, verbal portions of it where the students can read along and hear with some of their favorite staff members some important information about feeling well, about how to cope during these COVID times. What is COVID-19? So these address some important topics, and they are very socially appropriate for our students. We've reviewed them, and you should receive some instructions over the next week or so about where they will be posted. And we really started out with the younger kids, but I reviewed them myself, and I think that they could be very appropriate even for our middle school and high school. So it's really a very non-confrontational way to provide important information to all of our families and students as we prepare to, in the future, come back to school eventually. So please look out for those social stories, and you could feel free to give us some ideas or thoughts on additional social stories that we will produce in the future. So please, if you don't see information on that, please reach out to your building principals to get information where that is posted on your building page or on the Tiegerman website. Another new idea or component to the remote learning program that we are going to be initiating shortly. Some of our students have behavior intervention plans on their IEPs and have support plans. They're not, formalized behavior intervention plans like the ones that are IEPs. Some students have some informal plans that we work with the children on in school to make sure that they are performing appropriately and staying on task and trying to engage as much as possible with the work. If you are finding that your child is having difficulty staying motivated, remaining engaged with the instruction, please feel free to reach out to your building administrators or to your child's psychologist, counselor, or each building has a behavior specialist, and they have been instructed by me to work with you to provide you with strategies, interventions to help your child at home. I know it's not easy with all the distractions at home and everything that's going on. So they will work with you to create, if your child needs a token board, or if they need suggestions or strategies for you, or if we need to even put together an informal support plan, we will do so to support you and your child during this remote learning period of time. Most of you probably are aware. If you are not, I made this announcement last week. It's been about a week or so since Governor Cuomo made his announcement about extending the school closures through the school calendar year, and that puts us to June 26th, 2020. Friday, June 26th, 2020. We are closed. We are still operating remote learning world and doing teletherapy, but we will not be returning to our school buildings. And there continues to be a great deal of discussion. And as I've mentioned to you many times before, as soon as we get any information, we will alert you immediately. At this point in time, we've been informed that there are ongoing discussions and that they are still making a determination, probably towards the end of May, about what happens with the summer. We will definitely be having programming because all of your children have 12-month mandated programming. But the question is whether that will be in our physical space starting on Monday, July 6th, or whether we will continue through the summer session, the 30-day summer session, by means of remote learning and teletherapy. As soon as we hear, we will let you know. I'm very happy to announce that this Monday, May 11th, as you've been hearing over the last couple of weeks, we are officially going live with Google. Yay! So we've worked very, very hard on this. We've heard from your feedback. We've heard from many families that we're pushing for this. They're very excited, looking forward to this. There's been a bunch of heavy lifting and training with our staff over the last couple of weeks, and there will need to be some training with all of you. We've put out a great deal of information, training videos that you might have seen in my presentation last week with Woodside Principal Nina DeVita. You should have already received written notification and links on whether they be video trainings or written tutorials for you to provide you with walkthroughs. You should also have received by today is Friday, May the 8th, you should definitely have received contact from a staff member in your child's building. We're supposed to provide you with an individualized walkthrough to make sure that you know your child's username, password, walk you through getting on, helping you, provide you with very preliminary tutorial or walkthrough on the Google Classroom, because these classrooms should really be close to being up and running at this point in time. And also contacted by the therapists, so to make sure that you are familiar with the calendar that will be on your child's classroom, that will be giving you information about when your sessions will be scheduled. We're also working with our IT department to make sure that if anybody is sending you a notification through an email, that works. There have been some hiccups with it, so that's still getting worked out, and we'll make sure that over the next week or so that everyone should be receiving. If you're supposed to be getting a notification for an appointment or an announcement of some sort, we will make sure that that we will get that worked out. At this point in time, I can guarantee to you that by Monday morning, if you log on, okay, you will be able to access all your child's work, okay, whether it be for the day or for the week. And also you should have access to that calendar. So even if you're not getting, I know the therapists are trying to send email notifications to all of you to remind you about when your child's next session will be scheduled for. If you're not getting that, you can simply log on, and in the Google Calendar, in the Google Classroom, your child's services and the calendar for the week should be there. If you're having any issues with navigating it, if you have any questions about it, teaching assistants will be calling you starting Monday morning to, as they always do, collect attendance. You can ask questions to them, and you could always forward other questions regarding the format, any other issues that you have, to teachers or to your building administrators. Okay? Next week, we'll do the best that we can. I know that in weeks past, I've talked to you about trying to accomplish as much work as you can, trying to help your children to remain as engaged as possible in the platform. I recognize next week with trying this out, and many of you have a great deal of experience because you have children in other schools and other programs who utilize Google, so you're not gonna have issues, but there may be some troubleshooting issues. So please do not get yourselves overwhelmed. We understand it's going to take a week or so for you, new to the platform, to get acclimated to it. So please do not get so stressed out. We will work with you, and if work doesn't get accomplished, just let somebody know. We'll help you get it accomplished, or you'll just get a pass, or you'll just complete it several days in the future, or a week in the future. If you have to take a week to get that accomplished, we understand. We'll work with you. Okay, the last portion of my presentation, I will see if I have, I'm pretty decent with navigating and sharing this with all of you. Let's see here. Here we go. Okay, so I'm pretty decent, I think, with using this now. I went over our preliminary transition plan, and I forewarned all of you that this was coming. And this is not finalized yet, because in the weeks leading up to when we will be directed to open, we are going to continue to evaluate this and continue to make tweaks and changes to it. And as new information comes out from guidance from the governor's office, from the Department of Education, departments of health, local school districts, they will provide us with information on guidance to help tighten this this transition plan up before we are required to open. But the last time I spoke to all of you and I showed all of you this transition plan, I mentioned to you that there were going to be some generalities or certain things that are going to be as an overview, philosophically would be the same across all buildings. So each building plan has been submitted to Dr. T, Dr. Radzowitz, and to me, and we have reviewed it and we have approved it for each building, and it has been shared with the teachers, and some of their concerns and questions have been answered. And so what I did with all of these building plans is I summarized them and I brought them together into one document that we did last week submit up to Albany. The governor is interested in everyone's ideas, and we are a unique kind of situation. We are not like public schools. So he's interested in receiving feedback from various sectors, and he's putting together task forces. So we forwarded our finalized plan for all of our programs to him last week, and we're waiting to get feedback. And I assume that once we get feedback, we will make the adjustments that we need to, or we will be informed that it is good to go. And hopefully he and his team or the task force that he assembles will utilize some of the suggestions that we make, because I think it's very important for all of us as the educational community to get together and put our heads together to work on some very complicated issues. And we don't have all the answers, so we have to, depend on our communities to help us out solve these issues. And there are many things that we haven't accounted for or thought of. So we're open to everyone's feedback, and that's why I want to share this with you. I want to share this with you to hear some of your feedback if you're interested in sharing. And we're open to it because we want to make sure that everyone is as comfortable and ready to return to school when that time is when we are informed that it is time to, and we have to be ready to return. I want to reiterate and say we have not been informed that we have to return anytime soon. We are closed through June 26th through remote learning, and we expect that we will be having summer session, but we're not sure as of today whether on Monday, July 6th, we will be in the physical space or whether we will continue on with remote learning. So without further ado, here is the plan, okay? And I will go over some of the specific areas because they're important. These are the areas that we felt are the most important within our control in the school building. I did speak to you before about transportation and my concern, and we are very open to providing information, suggestions to the Department of Education and to your local school districts and their transport, specifically Office for Pupil Transportation, OPT, and the bus companies that your local school districts work with. So we're open to working with them, but we don't oversee that. So they may have their own ideas on transportation, and that may be something that you want to communicate to them about your thoughts on that. And we will work with them. But in this plan, we can only include what we oversee, which is within the school building, okay? So the first area relates to arrival and dismissal protocols. These are very important things to consider because when we are having students arrive and be dismissed, lots of times there's a great deal of staff congregating all together, and students are coming in all together in large groups off the bus. So we have to really look closely at that and make sure that we are helping our students and our staff properly socially distance and not take in too many students at once. This may result in busing where we are admitting students to be a little bit longer. We like to get kids in and learning as quickly as possible, but we want them safe, and we want to make sure that we're doing everything we can to get kids in a reasonable amount of time, but in a safe manner. Okay, so once students are brought in, okay, and we are talking about if we're going to be taking temperatures at the door, we are considering that. All students and staff, once they enter into the building, are going to be asked to wash their hands and sanitize pretty quickly upon entering the building. We want to make sure that we are cleaning as much as possible throughout the course of the day. And that first moment in the day is with the students and with staff. Sanitize, wash hands, okay? I've mentioned to you, part of our plan is in trying to acquire as much PPE as possible, and we are continuing to try to acquire that. We, at this point, believe that we have acquired enough PPE for our staff for 2 months. That means gloves, that means face masks and face shields, and also we're investing in fogging, um, fogging equipment, and we already had a very robust disinfectant program, and that's going to be, I'm going to mention that to you very shortly, but that will continue on with our maintenance staff. And we're also investing in an air filtration system that will help to eliminate pollutants in the air. So that will be happening as well. So with regard to the PPE, okay, this is really going to be something that I think that you're going to have to work with us on, because we're going to try to have as much PPE equipment as possible, but I'm not sure we're going to be able to guarantee at this point in time PPE for all students. And this is something that I'm asking all of our families to try to start working with your children on, if you can, to try to acquire a mask. And you know, it may make sense to try to get something that's reusable, that can be washed every day, and something that your child feels comfortable with wearing. They could decorate it. But I know this is going to be a very, very challenging task, not only for all of you at home to try to acquire it, and we will help you if we have families that cannot get, we will help you. We're not leaving you stranded. But this is also going to be a challenge for children to wear. I'm not sure, even my children, you know, I have to be giving them a good talk when they go back to school, but they may feel quite uncomfortable about wearing it, and they may not wear it throughout the course of the day. So that's why we're having these conversations and discussions now with you, to talk to your children about it, try your best to get something, and have them practice wearing it. Because I think that'll be very important, not only to their anxiety or worries about returning to school if they have, but also for you, your worries about returning to school, and helping everyone to stay healthy. This is very, very important. And this is one of the topics that is in the first social story, is helping everyone to feel well. And it talks about wearing masks. So that is another topic of discussion that we will continue to have going forward, about mask wearing and PPE, and how to make sure that we have it and how to make sure that you have it. If you have any suggestions, please feel free to let me know. And I'm open to your thoughts about having your children starting to practice wearing it and talking to them about it. We have staff that clock in and clock out every single day in the morning and afternoon. We have time clocks, and that will be discontinued. We don't want people congregating in places. So there is an option to do that through the online means, through their mobile phone, or they could do it on a computer in the classroom, but we want to make sure that people are not congregating. So that will be something that we'll be instituting, okay? I mentioned to you before about taking temperature. We'll be trying to take temperature immediately upon staff and students entering into the building, and throughout the course of the day in the classroom. I will not give specifics about how often temperature will be taken. We will leave that open to the teachers and to the teaching staff and to the therapists who are working with students whenever they deem it appropriate. But these will be the thermometers that are over the forehead scans, so it does not have to be something that's put into your mouth or put into your ear. No touch. Dismissal will be conducted over the loudspeaker. No congregation. In some buildings, we have students leave their classes, go through hallways, and go to busing rooms. In other buildings, they all congregate together in the lunchroom or in the gym and are dismissed from there. They will be staying in their classrooms. Announcements will be made. Students will be helped by staff to go directly to the bus, so we don't have too much of transition through the building. General safety cleaning procedures, very, very important. We need to make sure that we are practicing healthy, safe habits, and that we are trying to disinfect our physical space as much as possible. So classroom surfaces will be cleaned by staff multiple times a day. We're going to ask maybe, and when it's appropriate, it's not the student's job to do it. It is the staff's job but it may be an activity that everyone gets together and we teach personal responsibility to students. It's a good responsibility for students to learn so they take home and they clean up after themselves at home. Okay, maintenance will disinfect high-risk areas up to 4 times a day, or at least 4 times per day. Bathrooms will be sanitized regularly. This is very, very important because everyone is going to be utilizing it. There's no way to avoid this. And even though we try to keep students and staff, keep them in designated areas, there's no way to avoid it. People are going into certain parts of the building, and we need to make sure that we do not spread germs and that things are disinfected, okay? Unfortunately, I know everyone's very sad, field trips, travel training for our young men and women in the high school and sometimes in the middle school. These are important skills to learn, but we just cannot risk your health and safety. We recognize that learning is paramount, but we will do the best we can to do virtual things in the building. We cannot have you leave our building just to go home every single day. We will be posting health and safety tips, not only for our staff, for our students, that are age appropriate throughout the course of throughout the building, to make sure that we have reminders on washing hands, social distancing. So we will go over some of this information with you as we get closer, so maybe that you can reinforce these very helpful tips to your children at home. This is not defined, and this is not set in stone, and this will be definitely maybe chaotic. So we have to make sure that we are doing this in an organized and safe way possible. Many parents and families, in addition to having the children go home on buses, some parents and families want to pick up their children at school. And so we have to come up with a plan. You, of course, can pick up your child at school. So we're not saying no to that. But I want to make sure, just like we have our very organized, socially responsible and safe distance for admitting students on and off and putting them on the bus, social distance situation, in addition to how we're doing staff, sign in, sign out, no congregating. We're going to have to be very careful with how we're going to be admitting students into the building with their parents, drop off and pick up. So we will inform you of that, but there will be policy on coming to the school building I'm not talking about visitors now, I'm talking about parents. You're entitled to come to the building, but they're going to be very strict guidelines, because we have to keep not only our students, but our staff safe, and keep you safe as well. Classroom layout, cafeteria layout. Within each classroom, and I mentioned to you in weeks prior, no departmentalization. There may be some movement for related service, but all students will be in designated rooms throughout the course of the day with their cohort group. Teaching staff will probably be rotating through for departmentalization, but all students will be in their classroom throughout the course of the day, with the exception of, as I said, related services, or maybe to go outside. But we have to look at that. We have to look at that very, very carefully, okay? The other thing that we're going to be really thinking about and looking for some guidance and direction, possibly from DOH or from the governor's office for the transition plans, or from local school districts to the DOE, is how we are putting these classrooms or operating these classrooms. So we know all students can be sitting in the classroom, but are we to make sure that all students' desks are 6 feet apart? We got to measure that out. Is it okay for pods to be together? So we're going to split the classroom into 4 pods, 3 kids together in one corner, 3 kids together, 3 kids, 3 kids. Can those desks be together, or do they have to be every single desk spread out by 6 feet? We'll look into it, and whatever we are directed to do, we will do, to make sure that the instruction is as effective as possible, as well as the health and safety of your children and of our staff is is taken into consideration and that we are protecting everybody. Another idea that has come forward is everyone's desk will be their designated desk throughout the course of this pandemic. So while we will be relentless in cleaning desks and equipment on a daily basis, many times a day, we will not be switching desks and seats. Your child's desk will be his or hers throughout this pandemic. We will label desks, and that will be their desk and chair, and they will utilize that. And so we will not have spreading of germs if we are sharing. Cafeteria, I mentioned to you before, we will not be having group gatherings. I'm sorry. This has been very, very important for all of our students to get together, see their friends in other classrooms, and socialize. We cannot risk that. Lunch will be in everyone's classroom. And cafeterias will be utilized probably for related services. So related service providers, after we presented our initial plans to them, and I'm not sure if you felt the same way, but as a parent, if my child had a related service in a related service provider's office, which sometimes can be small, in a group, I would be concerned. So what we decided is that the related service providers will be doing related services in larger space. We will have partitions in the lunchroom, partitions in the classroom. We will limit the number of students in there at a time. They will definitely be far away from each other, but we are trying to make sure that the provision of services is as effective as possible, but also as safe as possible. So we are considering this, and I think this is the most likely of scenarios. Classroom instruction, we've talked about this before. All students will receive instruction in their homerooms or classrooms. Teachers will rotate through each classroom. Physical education, if the weather is nice and we determine that we could practice social distancing outside. I know that in team activities, I don't know if we could do that. And if we have, I know in the high school, we have the basketball court. We'll have to look into that if everyone can properly social distance there. And in Glen Cove, in the elementary school and preschool, we have the outdoor equipment. Can kids properly, safely do that at a distance? I don't know. So we'll talk about that. We would like everyone to get outside when the weather is nice. That vitamin D is very helpful, but we will look into that. If we cannot do physical education outside when the weather permits, we will do it in the classroom. All right. And as I mentioned to you, students will if appropriate, partake in helping their classroom take some personal responsibility to help their classroom be organized and safe and clean when appropriate. Related services, group and individual services will be in the cafeteria or gym in larger spaces. There may be some other spaces that are deemed appropriate that are large enough spaces, but we will keep you posted on that. Therapists will be provided laptops so that they don't necessarily, because they're not going to be working in their smaller offices, they'll have to do some of their work in those larger spaces and allow them to meet your children in those larger spaces and conduct their work there. If we need to, I know that in counseling, where not sure, we try to keep confidentiality. This is school counseling. This is not really psychological therapy that we would be doing outside of you're doing with a mental health provider, a psychologist or psychiatrist. So we want to respect that confidentiality, but it's not really heavy duty psychoanalysis, psychotherapy. So we'll get noise machines. I get that, but we'll do the best that we can with that. Therapists, if the session is a push-in service, we will have the therapist. I'm not sure we really have a choice. The therapist will push into the classrooms because those are not pull-out services. And elevator use will be restricted because that is a confined space. If somebody has a significant ambulatory issue due to ADA, America's Disability Americans with Disabilities Act, we will certainly respect that, and have to utilize the elevator if highly necessary, but all other use of the elevator will be restricted. Lunch, restroom protocol, I mentioned it. It's unfortunate, no lunch in the cafeteria, it will be in the classroom. For our older students in the middle school and the high school, where there's a snack shop, where sometimes they are microwaving lunches and doing vending machines, that will not be permitted. Students will be required to bring lunch to school and have their lunch in the classrooms. And all students will be escorted to bathrooms to make sure that students are utilizing the bathrooms in a safe manner, and that we do not have too much traffic and too much of traffic in the bathrooms. We will limit that because we don't want students coming in and out or being in the bathroom at the same time with one another to protect each other. There will be visitor protocols. Like I mentioned to you, parents and families, we're going to have to take a real hard look at this and make a determination how to do this as safe as possible. But we also have vendors that deliver essential items, equipment, supplies to the school. So we want you to know that we're taking a hard look at that because we want to protect your children. We don't want any unnecessary interaction or any unnecessary individuals who don't need to be there coming to, can we process this stuff outside of the building in any manner, and then just have our maintenance staff, process it, in our receiving areas. So we're looking into this, but we want you to know that we are the utmost important to us is the health and safety of your children, and we don't want to risk that, as well as for our staff. So we're taking a hard look at that. Meetings, any kind of meetings, we're going to be really pushing for it to be done in the virtual world. Many of you have become more comfortable with the use of Zoom, you'll be more comfortable with Google Meets. So we're going to be pushing for these meetings to be done virtually so that we can ensure that we don't have too much traffic, too many people in the building at once. This is what we sent to the governor's office. We believe that it is a strong plan, and that the specifics, these are just general overviews, but the specifics of it will be laid out in each building plan, because each building has your unique issues and circumstances in each building. So we will be forwarding that out to families in the weeks and months to come, certainly before we open. So I want you to know about that, but I wanted to share with you our finalized plan that we sent to the governor's office. Whatever feedback we receive from them, we will let you know, but we hope to help guide the decision-making for a return to physical spaces, because we've been planning and we've been thinking about this. And the point of this is to make sure that we're all on the same page, that there's transparency, and that everyone will be nervous, but everyone feels as comfortable as possible prior to our return. Okay. That takes us pretty much to the end of today's presentation. I wanted to, again, thank all of the essential frontline workers for all that you're doing. I want to thank all of the parents and families for working with us. You've been such wonderful team members to us in conducting remote learning and teletherapy. We couldn't do it without you. I want to thank all of our staff. You have been extraordinary. This week was Staff Appreciation Week, and I can't think of a better staff. I can't thank you enough for all that you're doing. We have a wonderful, tireless staff who do whatever they can to the best of their ability to meet your children's needs. So just know that, parents and families, you have a wonderful team at Tiegerman. And I also wanted to share with you my thoughts about the State of the Union going forward. Now that we have some clearer indication of school closure, and we're still waiting for summer, we know that we are going to be in the Google world, we're going to be in the remote learning world, we're going to be in the teletherapy world at least through June, and maybe even through July. The updates will still come, but they may become less frequent because we've really put in the heavy lifting. And as we become more comfortable with it, this is kind of what it's going to be. So I've had thoughts about my State of the Unions going forward. We will continue to do this on a weekly basis because the interaction, the updates when they come, you'll get them, but the interaction between me and all of you is so very important. Some families and some staff have indicated that they look forward to this. Some have said this puts them to sleep. You know who you are. So if you use this as a sleep tool, then fine. But I will continue with this. But I'm going to try to get a little more creative. So look out. I'm not promising you that next week will be the first one, but I'm going to try some new innovative things during these get-togethers, these updates that hopefully you'll enjoy. All right? To all of you, thank you so much. I appreciate all that you're doing. Have a wonderful weekend, and I will see you next week. Take care.